Hi guys, today topic is the Wallerian degeneration. So what is Wallerian degeneration? So Wallerian degeneration is the process in which whenever your axon is damaged, the distal to the damaged part of the axon undergo degeneration along with its myelin sheath, right? So before going into the depth of the Wallerian degeneration, I want you guys to know about, like in the CNS system, in the central nervous system, and in the peripheral nervous system, myelin sheath is formed by which types of cells. So in CNS, the myelin sheath is formed by the oligodendrocyte, right? So in CNS, myelin sheath is formed by the oligodendrocyte, right? I'm just writing over here oligo. So how I can remember this oligodendrocyte? I make this C into O. So that is how I remember that the oligodendrocyte make the myelin sheath in the CNS. Now the other is the peripheral nervous system, and in peripheral nervous system, your Schwann cells, they are responsible for the formation of the myelin sheath, right? So what is happening when your axon is damaged in the peripheral nervous system, and what is happening when your axon is damaged in the central nervous system, right? So when your axon is damaged in the peripheral nervous system, what is happening to the that part of the axon which is damaged? So whenever your axon is damaged in the peripheral nervous system, so by peripheral nervous system I am meaning about the neuromuscular junction or your peripheral nerves, right? So what is happening over there when your axon is damaged? Let's say this picture is clearing, but I'm making over here. Let's say this is the transecting part of the axon. It is damaged. So this part of the axon, it is undergo degeneration, right, along with the myelin sheath. How? The Schwann cells. So the Schwann cells in the peripheral nervous system, they secrete the cytokines and chemokines. They causes recruitment of the macrophages. They eat up this debris, right? And also this Schwann cell, they release the tropic factor, right? So this tropic factor, it causes the regeneration of the proximal. So this is the distal part of the axon which is damaged, and this is the proximal part. So this Schwann cell, they secrete the tropic factor which causes regeneration of this proximal part of the axon. So what is happening in that attempt in regeneration? They usually form a growth cone or stump over here, right? And that is usually called neuroma. They will give you a question scenario that a patient come with a C-section, and no, a patient with a C-section coming after years and saying that, like, when I put a hand on my lower abdomen, it produces a lot of pain. That is why you have the reason is that patient have formation of a neuroma at that, because in C-section you are cutting the axon, right? In a C-section you're cutting the axons, and neuroma or the growth stump is happening over there like this way. It produces a lot of pain because it is having a lot of node of Renvier and sodium channels over there, and a lot of flexion protection, and a lot of pain is producing over there. So this is how the Schwann cells are happening. Schwann cells causes the degeneration of the distal part of the axon, and also the regeneration of the proximal part of the axon. So what is happening in case of the CNS? So in case of CNS, oligodendrocyte, as I told you, are responsible for the formation of myelin sheath, right? So in CNS oligodendrocyte, they are from the myelin sheath. So what is happening over here? So oligodendrocyte, when the axon is transected, right? When the axon is transected, like over here. So when the axon undergo transection or transected, what is happening? The oligodendrocyte undergo apoptosis, right? They undergo apoptosis when the axon is damaged, right? One part. Secondly, macrophages are phagocytes. Sorry, not the macrophages, phagocyte. In the CNS, those phagocytes are called microglia, right? So microglia, they comes to that site of the damaged part, and they causes the removal of the myelin debris, right? And this process is very slow. Why? Because of the blood brain barrier over there, right? It take a lot of time, years, to like clean this debris, and sometimes myelin debris are persisting over there, right? As this process is so long, so there will be no generation of the neuroma. Secondly, the astrocyte, which like responsible for the formation of the glial scar, right? Glial scar is formed in case of CNS injury. So glial scar is formed by the astrocytes. So astrocyte, they basically come over here, and these astrocyte are they're producing inhibitory factor, right? Inhibitory factor. So that inhibitory factor causes the growth suppression in this part of the axon, which is the proximal stump. So there will be no growth stump or the growth cone is formed in case of the central nervous system. Why? First, the process is very slow. Secondly, astrocyte, they causes release of inhibitory factor, and that inhibitory factor causes uh, suppression of this growth of the proximal part of the axon, right? So this is whole process of the Wallerian degeneration, how it is happening in the CNS and how it is happening in the peripheral nervous system, which I told you. Thank you so much, mate, for thank you so much. Okay, let's wait for the next video. Thank you so much. Bye bye.